This digital story is about the chronic disease diabetes type 2, which is listed in 12 chronic conditions in AIHW. According to AIHW, chronic diseases are characterized by complex causality, multiple risk factors, long latency periods, or prolonged course of illness and functional impairment of disability. In my clinical practice experience, I have seen quite many people with diabetes, and here I would like to discuss about Patricia Sand. She has many associated health problems resulted as a complication of diabetes. This is a major problem in Australia. Therefore, to address such chronic conditions, NCDS is developed. The main aim of NCDS is to improve chronic disease prevention and care across Australia. The strategies of NCDS is based on specific frameworks for caring individuals with chronic condition. Since the case discussed here is about diabetes, the NCDS has the strategies to manage and prevent diabetes. The National Service Improvement Framework for Diabetes is a tool that addresses the presented chronic condition diabetes. So now talking about the management and prevention strategies by NCDS, they have couple of objectives to address this problem. The NCDS has 4 action areas, and among them I have chosen self-management for this chronic disease diabetes. NCDS states that self-management principle aims to optimize people's capacity to self-management throughout the continuum of chronic disease prevention and care. Australia is culturally and linguistically diverse, and Patricia was from non-English speaking background. From my experience, I realized that the patient was not able to express her concerns regarding her condition, and the information provided to her was not perceived appropriately. So in this situation, the self-management action plan as listed by NCDS can be a good example to help Patricia manage her disease condition and prevent further complication. The self-management strategies encourages health promotion, risk reduction, informed decision making, care planning, medication management, and seeking for help. Many studies and literature supports for the self-management for treatment and prevention of diabetes. Patricia's medical records showed that she was frequently admitted in hospital, so it is advisable for her to follow the principles of self-management. Based on NCDS self-management action plan, Patricia can use an internet-based resources, telephone counseling, mentoring, and peer-based support to seek for help. Secondly, the Finder model, which emphasizes on providing training to the healthcare worker and so they can educate Patricia. Thirdly, the Stanford model, which involves the people from chronic disease learn from each other's experience through sharing their experience. These strategies can help Patricia for her self-management of the condition. Effective communication is essential to enhance Patricia for her self-management. The future directions for self-management are to reorient the health system to support self-management. There should be adequate funding and changes to the care system as required. The health system requires a cultural change, and the health workers should be culturally competent. Patients' participation can be enhanced by involving them in decision making. The improvement in peer, disability, and aged care support is crucial in self-management. And finally, making people and community aware about the self-management. These are some of the recommendations for self-management of chronic conditions.